All right, welcome to part 3. In part 3, I'd like to begin by discussing the differences between the true and the false pelvis. So let's start by identifying the brim of the pelvis. And you can see it's kind of outlined here with this blue dotted line. So this is again looking from the anterior perspective, but I also want to draw your attention to the dotted line here. This dotted line and this dotted line are meant to represent the same thing, the brim of the pelvis. So let me describe what I'm talking about. The brim of the pelvis is the superior portion of the pubic symphysis. You can see that here and here. Anteriorly, so that's the anterior part of the pelvic brim. And then the sacrum forms the posterior part of the pelvic brim. And again, you can see that here on the lateral perspective really nicely. So if you were to draw a plane through the brim, see the dotted line here again, you would divide the pelvic area into two cavities. The area above the pelvic brim is the greater or false pelvis. You can see it's kind of this area here. The wings make up the lateral portion. And the area below the pelvic brim then is your lesser or true pelvis. So the wings of the ilium, as I said, form the lateral and posterior parts of the false pelvis, whereas the abdominal muscles form the anterior limits of that greater or false pelvis. So imagine abdominal muscles here, again forming the anterior part of the false pelvis. The lower abdominal organs actually rest on the floor of the greater pelvis, as does the fetus within a pregnant uterus. And we'll see that better in the next slide. The area inferior to the plane drawn by the pelvic brim, so the area below that line, is the lesser or true pelvis. The true pelvis is a cavity that is completely surrounded by bony structures. The size and the shape of the true pelvis are of greatest importance during the birthing process because the true pelvis forms the actual birth canal. And you can see that better here on this, this diagram here. So let's talk a little bit more about this true pelvis. The oblique plane that we talked about in the previous slide that aligns with the pelvic brim, this line right here, is also called the inlet. Remember, the plane of the inlet extends from the pubic symphysis anteriorly to the sacrum posteriorly. So this is the fifth lumbar vertebrae. This is the top of the sacrum. And then, of course, you have the coccyx here. So that's the inlet. The outlet is made by the two ischial tuberosities and the tip of the coccyx. Okay, so if you were to draw a line between the ischial tuberosities and then from each ischial tuberosity draw a line to the coccyx, that forms the outlet. You can also see that line drawn here. The area between the inlet and the outlet of the true pelvis is called the cavity. And during the birthing process, the baby must travel through the inlet, through the cavity, and then through the outlet of the true pelvis. And in this picture, you can see that the fetus actually sits on the floor of the greater or false pelvis. Okay, so years ago, if there was any question about the dimensions of the birth canal with relation to safe delivery, the doctors would order an abdominal pelvic x-ray, kind of a KUB. And then they would actually measure the size of the birth canal. This is called pelvimetry, and it's generally not used anymore because we know that the fetus is so sensitive to radiation. Now, if there was any concern or question about the size of the birth canal, they could certainly use ultrasound. That would be a more appropriate modality to visualize any potential birthing problems. So let's just recap. Above the brim is the false or greater pelvis. Below the brim is the true or lesser pelvis. Okay, just to recap. You may hear the term pelvic ring. The pelvic ring is a term used to describe the ring-like structure formed by the ilium, the ischium, and the pubic bones, along with the sacrum and coccyx, of course. We'll talk more about the pelvic ring when we discuss pathology, but it's important to us because of a thing called pelvic ring fractures. So kind of this circle that you see describing the inlet, that from the anterior perspective also describes the pelvic ring. Okay, I know that's a bit confusing, so when we're in lab, we can look at these structures more three-dimensional. Let's look at the differences between male and female pelvis. So in general, the female pelvis is wider, with the wings being more flared, and the pelvis is usually shallower from front to back. The female pelvis also has a rounder pelvic inlet. Okay, again, pelvic inlet being here, which makes sense for childbearing. The male pelvis is typically narrower and deeper, and the wings are typically less flared. Men also tend to have kind of a heart-shaped inlet, as opposed to women's, again, who are more round. A second major difference is the angle of the pubic arch. The pubic arch is formed by the inferior rami of the pubic bone. In the female pelvis, the angle is between 80 and 85 degrees. In the male pelvis, the pubic arch is an acute angle, so less than 90 degrees, typically between 50 and 60 degrees. So women have a wider pubic arch, men have a narrower pubic arch. A third difference between the female and male pelvis is that the ischial spines generally do not project as far medially towards the pelvic cavity in the female as they do in the male. So these little bumps right here are the ischial spine. And I don't know if you remember in our previous lecture, I said sometimes you can see them on an AP pelvis. Well, look at how the males tend to project more medially than the females. Why might that be? Well, again, think of childbirth. The fetus has to pass through this inlet area. And so you wouldn't want those big spines, poking at the child, right? They are more visible in the male than in the female AP pelvis. So that's another or a third way that you can tell the male from the female. So let's take a look at some x-rays here. These are both pelvis x-rays. One is female, one is male. So let's recap. What are the three characteristics we look for? Remember, male pelvises tend to be narrower, less flared wings, and the inlet tends to be more heart-shaped in a male, not as round. Secondly, the pubic arch of the male has a smaller angle as compared to the female, and the ischial spines are less pronounced in the female pelvis. So which one do you think is female and which one do you think is male? If you said A is a female, you're exactly right. So let's look at these characteristics. Look at the wings compared to the male. On a female, they're more flared. They're less flared on the male. Look at the pelvic inlet. Much rounder on a female, kind of more heart-shaped on a male. Look at the pubic arch. Much wider on the female than it is on the male. Okay. Notice this is shielding here. They put a little circular shield over the male reproductive organs, so that's what you're seeing there. All right, good. So please be familiar with those three characteristics. Okay, and to finish up this recorded lecture, I'd like you to pause here and identify all of the anatomy labeled on this slide. Now, the answers for this slide are found in your textbook. Good luck.